The idea for this book was born from a need to bring order to the care of a person living with schizophrenia. There are many publications on the market. Some are too technical and medical, while others drift toward concepts unrelated to contemporary psychiatry, shamanism, esotericism, or methods lacking any scientific basis. As a result, there is a shortage of practical guides built on solid foundations and written in language accessible both to the patient and to the caregiver. Originally, I intended to create 20 short and concise lessons for the patient, aligned with Western therapeutic guidelines and usable in places where access to group or community-based therapy is limited. In many countries, especially developing ones, the healthcare system is effectively on its knees, and psychiatric treatment is often reduced solely to medication. Yet real schizophrenia therapy takes place not in hospital wards, but at home, in the rhythm of everyday life. It is the routine days, when structured well, that determine remission or relapse. A lack of knowledge among families and caregivers often leads to patients being treated exclusively with neuroleptics, sometimes in doses higher than their symptoms require, while elements of behavioral therapy, psychoeducation, and community support are completely overlooked. This is a mistake. It is the combination of pharmacological treatment and a properly structured daily life that most effectively restores the patient's functioning. A doctor can prescribe medication, but it is the caregiver who stabilizes the reality in which the patient lives. For this reason, the second part of the book, 20 Lessons for Caregivers, became not only a natural supplement to the first, but a necessity. The caregiver, equipped with knowledge, insight, and therapeutic tools, becomes the most important factor in recovery. The symptom journal, daily structure, shaping the home environment, responding to crises, maintaining routine and calm, these are often more effective than medication alone. When a caregiver understands this and acts consistently, the patient's chances of long-term remission increase significantly. This book was meant to be a short, light brochure. During the writing process, it grew more than I had planned, and even now I feel I have only touched upon the wide spectrum of experiences surrounding schizophrenia. I selected the topic subjectively, guided by practice, observation, and available medical materials. Some issues found in other manuals are not included here, while others rarely addressed, such as the role of spirituality, the importance of daily rituals, the influence of culture and religion, and the global context in which patients live and struggle, have been placed at the forefront. My goal was simple: to create a practical guide, not an academic one, something that genuinely helps in caring for a human being. Traveling around the world, I see how different the lives of people with mental disorders can be. In Africa, sick children are sometimes abandoned at church steps. In India, many patients live on the streets for years. In Poland and Western Europe, they often end up alone on the margins of social understanding. If you have reached the end of this book, it means that the fate of a vulnerable, lost person affected by one of the most challenging mental illnesses is not indifferent to you. It means you want to know more, so you can help better. I hope the knowledge contained in this book brings relief to you and to the person you care for. And if justice exists in this world, may it reward the effort and the heart you put into something that many people do not even notice. Thank you for your attention, your time, and your presence.